Hello, everyone, and welcome back. I've seen a lot of inspiring posts on social media, so I trust you're all learning a lot, feeling empowered and encouraged, and getting to know your fellow JA warriors.
Next, we'd like to welcome back our moderator, Michelle Ndweli, Director of Health Strategy, to introduce our keynote speaker.
Good afternoon, everyone, and thank you so much for joining the Navigating the Emotional Roller Coaster of Chronic Illness and a Pandemic keynote session. Just a few housekeeping issues before we begin. You'll notice at the bottom of your screen that you have an option for Q&A. As you're going through the presentation, please feel free to submit your questions, and we will have a Q&A session at the end of the presentation. We will try to get to as many of the questions as we can in the time allotted. Now, it is my pleasure to introduce our keynote speaker, Dr. Sarah Gonzalez Rodriguez. She's a pediatric psychologist at Children's Hospital and Clinics of Minnesota in St. Paul, Minnesota, with a focus on outpatient therapy for children and adolescents, including those with chronic illness. Dr. Gonzalez is committed to providing evidence-based treatment for her patients, utilizing cognitive behavioral therapy, motivational interviewing, acceptance and commitment therapy, behavioral interventions, and integrative medicine approaches. Welcome, Dr. Gonzalez, and thank you so much for being with us this afternoon.
Hello, everyone. I am so very excited to be joining you all today. It sounds like it's been a great conference already, and I'm looking forward to having this time with you. I was already given a great introduction, but I wanted to share a little bit about myself and why I'm so passionate about being with you all today. I have focused my training and work thus far into highlighting how mental health and pediatric services need to be coming together, recognizing the need for mental health supports within specialty services, especially those working with families managing chronic illness like you all. I have had the opportunity to work with families in different medical specialties, and I really value the importance of linking medical concerns and connections to the psychological aspects of health and behavior. So hopefully I will be able to share some good information and insights with you all today. Next slide, please. This is a slide about disclaimers and confidentiality protections at Children's Minnesota, my place of work. I have no conflict of interest to disclose. Next slide. Now, these are the main points that we will be discussing today. First, our world has shifted in the past year plus, and I will be sharing information on how mental health has been impacted or made worse by the COVID-19 pandemic. I'm also going to share some mood, thought processes, or behaviors to be on the lookout for and discuss how to reach out for supports when needed. Lastly, I will be sharing tips and strategies for navigating this new normal, how to take care of yourself and your loved ones to promote well-being. Next slide. As caregivers of an individual diagnosed with a chronic illness or an individual diagnosed with a chronic illness yourself, you have gathered this weekend to learn, communicate, establish connections, and gather in one large virtual space to continue to find ways to better yourself or the life of a loved one. Next slide. This quote that you are seeing on your screen was written by social scientists who have pioneered the study of medical illness and how it affects quality of life. Almost 50 years after these words were published, their essence remains true. Successful management of a chronic illness must focus not only on illness and symptom management, but also on supporting patients be individuals, along with their families and living happy and fulfilling lives. This is all true, and you know it more than anyone. However, what a year plus. I'll emphasize the plus. Since spring of 2020, we have had an overwhelming amount of public health as well as social crises that have impacted each and everyone in different ways. I want to start off by recognizing and validating that chronic illness its impact and the stress that a diagnosis has on each and every one of your lives is a norm for you. Your norm has always been heightened and stressful. Even if you all have found a way to make that neutral be successful, we cannot ignore that fact. COVID has really thrown us off. Our neutral is, because we're still in it, not so neutral anymore. And what was once easy to manage could very well now seem much harder, much stressful. Next slide. With that, let's take a minute. Let's breathe. Each and every one of your norms, your neutrals, even when you're used to it, can be challenging on many levels. Let's take a short pause to acknowledge all our individual hardships of this pandemic season that we may be pushing through. Next slide. I now want to take a moment to bring everyone back. Before the start of COVID-19 in our country, life seemed normal. We were possibly making plans for spring break 2020, maybe even looking into forward into the summer and dealing with work or school as usual. All of a sudden, everything stopped. Full stop, truly. The COVID-19 pandemic hit and everyone had to make massive changes and adaptations. Businesses having to close and readjust, schools having to shift the way they have forever done things, parents having to adjust to their children being home with all their activities canceled. Our access to medical services was a bit more daunting to navigate. Everything changed almost overnight, and we were left to figure things out very quickly. This prompted a collective rise in stress levels. In that moment, some of us might have done all right, thinking that we would get through spring, make it to summer, and hopefully things would have been normal in the fall. This is what in psychology we call crisis management, a short-term process with high levels of stress and cortisol levels in our bodies. But we are not meant to be in a crisis state for a long time. But we were, and we have been. It's been quite the roller coaster. Now we have to figure out a way to shift out of crisis mode, a view that this is the new normal. How do we find neutral in the middle of the continued remaining uncertainty and adapt to what is now the world that we are living in? Next slide. It is important to highlight that you were not only facing a large amount of psychosocial stressors brought along by COVID, but also a lot of diagnosis-specific challenges. You were facing challenges such as fear of qualifying for having an underlying condition. Did we not hear this a million times? Still, it is not as if you are all not thinking about the add-on concerns of what this pandemic meant for you or your loved ones. There was the challenge that others outside of this community would probably never think about, how to defy the impact of stress on chronic illness symptoms when we know that we often experience pain flares with increase in stress. As families, you also probably had the added task of questioning how to keep yourself and your loved ones safe, as well as worrying about others being able to understand why you couldn't participate, attend, be there, why you were maybe being even more strict or cautious than others were. Next slide. I cannot move forward highlighting mental health concerns as well as how to take care of your loved ones without discussing taking care of you. I'm going to take a couple of minutes to speak to parents directly. Research has found that children of parents that acknowledge their daily stress and prioritize daily uplifts and stress relief were less likely to develop symptoms of depression and anxiety. It is important to talk about parental self-care. Worry can come from a place of concern. We worry about others when we care for them. However, that may take a toll on you. Take some time to write down negative, anxious, or upsetting thoughts and feelings and find a different way, a more compassionate way to talk to yourself. Practicing mindfulness or gratitude can be especially helpful. It is easy to believe that if you take time for yourself, you're taking something away from your loved one. It is important to clarify, however, that if you're under too much ongoing stress, the needs of your family will become harder to meet. Find some short moments throughout your day to focus on your breath or enjoy a calming activity. It is also important to find balance in the activities that we do. Our routine should involve a balance between pleasure, achievement, and connection. If there's an imbalance, our mood can really struggle. If we're spending most of our time working without fun or socializing, then you might start feeling very disconnected and low. On the other hand, if you spend all your time focused on activities that are just for fun, this can also impact mood as we lose a sense of purpose. Ask yourself, what can you do differently tomorrow to maybe strike a better balance? Relationship dynamics can also be significantly impacted by stress. Openly talk about how taking care of your family, outside stressors, and individual worries are impacting you and your relationships. Lastly, lighten your load by breaking tasks or problems into manageable parts. Depend on friends and family, and rely on working partnerships with your medical care professionals, utilizing support staff at hospitals and clinics, consulting parents and support groups online or through events such as this one where you find your warriors can be really game-changing in managing stress. Next slide. COVID-19 has brought some of us closer and others not so much. Oftentimes, we will be tempted to focus solely on differing views and disagreements. However, we need to find common ground, areas of neutral. Let's take a moment to discuss some practical strategies for navigating these conflicts that can pop up at home, with family, friends, or even random others. In navigating conflict, it is important to stop, listen, and speak kindly. Once there, the task should be to find areas of disagreement, then move on to what you can agree on, and then brainstorm to find compromise, that neutral ground. For parents specifically, parent with intention. What is the teachable moment in this conflict? How do you find that neutral ground when your child diagnosed with a chronic illness is anxious about the world opening back up and their sibling is ready to explore maskless? What happens when your child is not wanting to go back to school because online school was easier? Setting boundaries for the safety and benefit of all family members will be important. When talking about safety, those arguing may not have reached those conclusions by logic, but by passions and ideals. Their thinking is less likely to change by logic, but by personal stories and by encouraging them to think of others. Lastly, let it go. Each and every one of you can make a strong case for staying safe and keeping your loved ones safe. Ultimately, though, we cannot control everyone's decision making. You deserve to protect your own mental well-being. So limiting relationships or situations that are causing stress and those that are not respecting your perspective may really be needed. Next slide. Before transitioning to discussing more specifics about the psychological impact of COVID-19 on mental health supports, I want to note that there is substantial research confirming that individuals diagnosed with a chronic illness are at a higher risk than their peers to be diagnosed with anxiety and depression. Managing a chronic illness by properly adhering to the necessary therapies, having to think about your body as different from others, navigating physical discomfort, all increase stress, which in turn increase the likelihood of mental health concerns. Let's keep this in mind as we navigate this next section of the presentation. Next slide. Research has been identifying that COVID-19, as well as social unrest, has increased potential for worsened mental health symptoms, as well as bringing about new concerns, giving a unique combination of stressors. There was a significant disruption in our access to mental health care, school and daily routines, and home and financial stability. For perspective, it is estimated that 35% of students receive their mental health services at school. That is a lot of students that went with services. Additionally, duration, rather than the intensity of feeling of loneliness, are more strongly associated with mental health symptoms. This is problematic in a world where we were all forced to take a big pause on social interactions for a longer than we expected time. Lastly, and specific to chronic illness, keys of success in disease management, such as movement, connection with others, and access to therapies and medical visits, were also significantly impacted. Next slide. Beyond the stress of the illness itself, stay-at-home orders, quarantine, and isolation, it presented new and longer than anticipated challenges. With the greater duration of isolation, inadequate access to service, economic instability, it became really tricky to figure out where we go from here, right? And research has found individuals have been reporting higher levels of mental health symptoms. Let's move forward in discussing how this specifically has impacted those with mental health diagnoses. Next slide. Individuals who are anxious have enough to worry about. Now, with the pandemic, there is and was so much more to be concerned for. With OCD in particular, especially those who have struggles surrounding germs and contamination, they may think that their greatest fear has come true. Symptoms may have been escalated. It's important to have these individuals be connected to their therapist and make sure that they reset the work that they're doing to be more realistic. For those with social anxiety, the pandemic may have caused a very interesting and maybe confusing dynamic. For some, to switch to having increased safety restrictions, doing distance learning, or working from home without having to worry about interactions with others may have provided big relief. But those with social interaction or social anxiety still crave social interaction. In fact, they really want to have these experiences with others, but the fear, however, will sometimes interfere with that desire. It's important then to discuss how to find social opportunities virtually, at a safe distance, or outdoors to have that social outlet. Often, however, it will be really hard for the person that has social anxiety to initiate this themselves. Think about how you can seek out support for yourself or how you can facilitate this for a loved one. Finally, those with general anxiety will struggle with having lots of things to worry about. Setting aside a worry time to have individuals be able to discuss with a caregiver or a trusted adult their worries for a few minutes, several times a week, and then set them aside may be very beneficial. Once this is done, shift your focus. Use distraction, fun activities, and relaxation techniques. Lastly, especially in this day and age, we're inundated by news that tend to cycle around negative pieces of information. Particularly for caregivers, kids do need to be aware of what's happening. That's important. However, I would encourage you to limit news exposures to a certain time frame and only allow information from trusted sources. Next slide. For those with pre-existing depression, this is a very difficult time. With more time spent in our homes, what would have been telltale signs of depression, such as being withdrawn and isolating, are much harder to recognize now. Setting times to have family meals together or join in on whole family activities is a good way to help those struggling with increased feelings of depression. Hopelessness can be fueled by bad news, back and forth of mandates shifting around COVID-19 and isolation. How long will COVID continue to interfere? Will we be able to do sports or other activities? Are we going back to school or work in the fall? These can all increase hopelessness, which puts these individuals at a higher risk for suicidal thoughts or plans. it is really important to check in with your loved ones and specifically ask about them having thoughts of hurting themselves or having a plan to do so. First, children and adolescents need to know that it's okay if they've experienced these. And second, for caregivers to know that it is okay to ask. If these have come up, it will be important to create a safety plan and discuss coping and positive strategies they can use. It is important to make others feel and know that they're not alone and that there are things that they can do. Talking to a therapist if they don't have one, relying on family members or friends to engage in positive activities, and seeking out other social supports as needed. Activating behaviors is extremely important too. It seems like a simple concept, but it is hard to engage in regular activities. We have been limited by COVID-19 as to what we can do. So it's especially important to discuss and come up with a list of activities that those experiencing symptoms of depression or those that are merely feeling isolated or alone can really engage in. Next slide. I want to also talk about those individuals who have not been previously identified as needing mental health or social supports and have been generally doing just fine. Now, with the COVID-19 pandemic, there might have been new and emerging mental health concerns as a result of the disruption and stressors of these times that we've been and are living in. Now, some individuals are doing well, but others have and are struggling. New onset of mental health concerns can be triggered by disruption of life and routine, missed milestones, significant family distress, and uncertainty of what the future holds. Specifically, for those with juvenile arthritis and related diagnoses, the world's pause due to COVID-19 may have also paused the progress that they had been doing in managing their symptoms out in the world. Re-entering the world may be full of concerns or hesitations, and discussing these will be of importance. We will talk in more detail about what to do. However, it will be important to check in with your loved ones and assume that all of us are dealing with change. Next slide. Well, I have not painted a very rosy picture of the implications of COVID-19 pandemic and how it's impacted those with mental health concerns, or how it may have even contributed to the development of some difficult thoughts, feelings, and behaviors. What do we do now then, right? We ask questions, we screen for signs of issues and concerns, and we seek out supports from mental health and medical providers. Let's dive into how to do this. Next slide. The most critical piece of identifying issues and concerns in our loved ones is by knowing that there is a small chance, a very small chance, that others will come to us and say, hey, I'm really stressed, or I have really been struggling. If we are waiting for our loved ones to openly say that they need help, we will miss most things. Let's take a moment. Think about how you feel when you're stressed. How do you know you're stressed? Can others tell? Stress can manifest in multiple ways. Stress can present as a shift in emotions. Stress can be physical. Are you or your loved ones all of a sudden experiencing lots of pain complaints? Can you not eat or sleep the way that you used to? Particularly those with juvenile arthritis or other rheumatic diseases, hiding behind the diagnosis or solely talking about discomforts as being part of the medical diagnosis may be tricky. However, oftentimes our stress will manifest in our body. The mind-body connection is very powerful, and having honest dialogue about our discomfort potentially being linked to stress and uncomfortable emotions is a must. Watching out for behaviors is another key element. Are we keeping to ourselves more than usual? Have we stopped engaging in things that we enjoyed? Cognitively, we may also find ourselves or our loved ones having a difficult time sustaining attention, or seeming aloof or very distracted. Next slide. Here's how we do that. We pay attention to subtle words or actions that may represent a cognitive, a physical, or a behavioral sign of stress. Normalize any and all feelings. Begin by shifting how you talk about emotions from good or bad to comfortable and uncomfortable. No emotion is bad. I'll say that again. No emotion is bad. Some feel uncomfortable in mind and body to experience, but no emotion is bad. Validate your own as well as your loved one's experience. Lastly, openly communicate about stress and how it's impacting you and your family system. Next slide. We discuss stress by having open conversations about our own stressors and struggles and encourage others to do it too. As parents or for our loved ones that are struggling, nothing is more important than having an appropriate display, an example of what it means to be emotionally healthy and talking about our own difficulties. We have to acknowledge, however, that there is potential discomfort in bringing in concerns about stress, emotions, or mental health. Say it out loud. Calling it out eases tension. Talking about feelings can be uncomfortable, but it is also important. Dive right into it with direct or indirect approaches. You know your loved ones best and what would encourage them to speak out. Be attentive, however, of conversation enders, the fines and the okays, the eye rolls, and avoidance of engaging with you. I really need to go clean my room now. Take that as a confirmation that your suspicions regarding something being of concern or being off may be right. Give some space, but continue to monitor. Next slide. If you are noticing your loved ones are not wanting to engage in conversation, here are some ideas. Stick to or create family rituals, things like family dinners or game nights. Show interests in your loved one's interests. Encourage your loved ones to restart things they enjoy or used to enjoy, and even volunteer to join them or bring a friend. Now, if you have already run into the issues of your loved ones not responding to dialogue, avoid the impulse to ask follow-up questions. And I know this can sound confusing, but try to use reflective and empathetic responses such as, "That sounds really hard," or "I see, that sounds difficult." Resist the urge to lecture and allow your loved ones to continue sharing without feeling judged or that you're taking the lead in the conversation. Lastly, if an argument does evolve because you're deemed to be overreacting, nosy, or there's no way that they can understand me and what I'm going through, pause. Hit the pause button. Developing a system for pausing arguments and this being okay within your home will do wonders. Everyone can cool off. You can return to the topic then with open ears and a fresh perspective a little bit later. If nothing is working, however, raise your concerns by talking about specific signs or changes that you're noting that are worrisome. Next slide. If you have identified signs and mood or behavior changes that are concerned, seek support. Let's talk about how to do this. Next slide. Finding a provider in your area if you're not connected to someone already can be a big task. It can be confusing and navigating the system can be really difficult. However, here are some ideas of where to start. Number one would be to contact your primary care provider or specialist that you trust. Be specific about your concerns and request a behavioral health provider that may be of support to you all. Also, schools are your friends. Within the school system, there are school counselors, school psychologists, and social workers. And this may be a great place to find recommendations for community providers, but also it could be an opportunity to establish services that you may have not even known were available within the same school. Ask other parents, ask your friends what their recommendations for a therapist are. breaking down the stigma, the fear about talking about mental health or needing mental health supports is super important. Lastly, contact your insurance or call providers local to your area. Be sure to ask about their credentials and what their practice focus is. If parents are involved in care, for the most part, you should be. And ask if they have an understanding of your or your child's medical diagnosis. Finding a mental health provider that you or your child connect with may be the most important thing. Do not hesitate to talk about fit or how you or your loved one is connecting or not connecting in the therapeutic process and what could next steps be. Next slide. I really enjoyed being able to be here with you all today, and I look forward to chatting with you all and answering your questions during the next portion of Q&A.
Dr. Gonzalez, thank you so much for that incredible presentation and for helping us just kind of navigate the different stages. Sometimes COVID seemed that it happened yesterday, and sometimes it seems like it has been going on for years. So it's kind of nice to be reminded of the context of the last year for all of us. I have a few questions. So the first is as regards to preparing for back to school. And so I had two questions, two different scenarios from two different parents. So could you give some idea of what the conversation could sound like for preparing a child going back to school who's excessively worried? What does that conversation look like, and how do you not feed into the anxiety and stress, but acknowledge it?
Yeah, absolutely. That is a fantastic question, Michelle. And I think the most important thing is to acknowledge that when there is a chronic illness involved, talking about the risks of COVID and what that may look like is not necessarily feeding into the anxiety per se. We need to take a step back and acknowledge that let's find what that neutral is. What is our comfort level? You may not be required to wear a mask, but would you feel more comfortable wearing one? Can we talk to your teachers about having more space? Is there a spot in the room where you would feel more comfortable in? We don't want necessarily to have our kids feeling like, oh, we shouldn't go back to school, or I'm not ready to do this, but instead shifting the conversation to talk about what are some precautions or some measures that you can be taking to make school feel a little safer.
Right. And then the next scenario is how to have the same conversation, but with a child who's more cavalier. And as a parent, the parent may feel like they want to make sure the child understands the level of risk and kind of what kind of behaviors they should engage in. So how do you help that conversation not be a tense or confrontational conversation?
Yeah, absolutely. And I think it's the same thing, right? How do we find common ground? Hear your kids out, right? They might be more comfortable saying, hey, mom, dad, person who's in charge, I feel comfortable being outside a recess without my mask, but maybe inside the classroom, maybe there, we're going to take these other measures and I want my distance. Listen, your kids also are in the middle of this, so there's less conflict when we hear each other out. And as parents, yes, you're always going to be in charge of setting those boundaries. That's definitely going to be important. If your child is having struggles in that way, maybe recruit their closest friends, or recruit their teachers. Right? How can the teacher also encourage that as a general rule for their classroom? Or how can their best friend also say, hey, I'm worried about this? Or how can we create some sort of buddy system to keep ourselves protected in some way? So listen, try to find common ground, recruit others would be my strategy.
All right. So another parent wants to know kind of how do we navigate the emotional up and down of the recommendation? So we're told to wipe our groceries down, and now that has changed. And, what happens, like, kind of how do we deal with the up and down of information changing, variance changing? How do we find that balance, that neutral you mentioned before, as a parent?
Absolutely. That's a tough one, right? Because we're trying to find trusted sources in the news. We're trying to find general mandates. it's hard. It's hard and confusing a lot of the times. And I think it's important to now more than ever have family check-ins. Hey, this is what's happening this week. Here's how we are adjusting. I think as a parent too, allowing yourself to take a moment, take a big breath. I know that can sound so simplistic, but allow yourself the space to be like, where am I now? Right? Even groceries seem overwhelming. What do I allow into our home? How do we manage the outside world? That's a lot. Family check-ins and giving yourself a moment to establish where everything's at and gather your thoughts and where the world is at and digest it is important.
All right, so I have a question from a parent who is a child who the parent is not recommending they return to their favorite sports activity, even though things are opening up. How do you kind of help a child deal with not returning? How do you have that conversation? Any recommendations?
Yeah, that's a hard one. And it feels like the impossible choice, right? As parents that we're trying to keep our loved ones safe, that will sometimes come at a cost. And I think if we're taking one thing away due to safety, which is very fair to have that conversation, I also think it's important to talk about, well, what can be an alternative and may not be our preferred or top choice, but how can we also supplement that time? We don't want as kids to feel that once again, I have no outlet for my feelings, no outlet for social connection. So if we're taking some things away due to safety, what are some things that we can safely add into the mix to really fill in those emotional and mental health needs?
Thank you so much for that. Our next question, how do we help our young adult regain their drive after many of their friends have dropped away due to COVID or have went away to college? So my daughter feels like she's starting over and she just doesn't want to do the whole arthritis talk. How do I help her be motivated again?
Yeah, absolutely. We were making a lot of progress. All of a sudden, everything was paused, and our progress in a way seems very paused. Some people may have kind of moved on. It- that it's incredibly difficult to sit with those emotions. In thinking about a young adult, I think the most important thing is when I sit and I look at what does well-being mean for me, even when it's bringing up these challenging things of having to navigate the pressures of an illness and the world opening back up, or once again having to re-explain what this means for me or why I may have been gone more than others during COVID times. It's a challenge, but if we can make kind of a pros and cons list of sorts, right, where we outweigh what would be the benefits of doing these things for me. And if they can't do them themselves as parents, I would encourage them to help out in how they've been really successful in the past and how to bring that in now.
The next question I can relate to for my daughter as well. It says, my daughter gets anxiety when falling asleep, worrying about multiple things, and it's really affecting her sleep. Any strategies or exercises that we can do to help her kind of calm down and find that restful sleep?
Absolutely. And sleep is so important, right? Sleep is this kind of snowball effect thing. When sleep is off, everything's kind of thrown off. And so there's several things. One is doing worry time, not close to nighttime. As I mentioned during the presentation, right? Having several moments throughout the week where you check in and we kind of list all out and just try to get that strategy down of being able to then set stuff aside. But specifically for sleep, I would look into doing mindfulness, audio, or some calming music, or trying to figure out a way to reset the brain. And how do we shut that out? Sometimes for kids, it's enough to create a what we can call calm down space in our brain, right? Really encouraging our young ones or even us as adults to think about, what is a relaxing place for me? I go to the beach all the time. And so I close my eyes and I go through all my senses, right? What do I see? Here's what I hear. this is how it feels. It's warm, it's cozy. And the more that we can do that exercise of a calming place for us in our brain, the faster that will make the brain do that connection of this is relaxed time. Let's push those worries out now. It's not the time.
Okay, great. The next question I have is related to siblings. So how do we navigate kind of the sibling resentment that is happening in our family as it relates to a child who's, of course, not diagnosed with juvenile arthritis, but the entire family dynamic, what we do, how we do it, where we go, everything has changed. And it's now getting into year 2. Kind of how do you navigate and acknowledge those feelings, and what do those positive conversations sound like?
Yeah, absolutely. I think going back to that spot where I was talking about navigating conflict, hearing everyone out and talking about, for now, we don't want this, right? Like no one wants to feel like they're kind of crammed at home or that they can't do the things that they want to do. But establishing ground rules is important. And then outside of that, navigating where we can be flexible, right? What are some activities that are still deemed safe by our family members and allowing those? And then setting times with how can we navigate these trickier ones that maybe we can't do right now? How can we plan for them in the future so that we don't feel necessarily that we're missing out?
All right, the next question is probably potentially in the conflict area, but it's two parents who are kind of not on the same page. And so how do we have those conversations when one parent is, let's go, we'll be all right, and the other parent is more cautious or maybe excessively cautious? How do we kind of strike that balance and maintain that positive partner relationship?
Yeah, absolutely. And without, I'll put this disclaimer out, right? Like without knowing the individuals per se, and I know I keep going back to setting this neutral and setting ground rules, but I would, as adults, I would have these conversations outside of children, right? I would first have these conversations as parents alone, right? The more that we can present a united front, the less conflict that we'll see navigating down the road. So setting some time with your significant other to sit, to pause, maybe write stuff out, maybe talk stuff out, whatever feels comfortable, and figure out some things, right? We're maybe not comfortable going to a big crowded activity. Maybe we are comfortable going to fly a kite at an open park and doing that and bringing food and doing a picnic instead of going to the new hip restaurant that may be crowded, right? So figure out what feels comfortable but still enjoyable for the family.
Okay. All right, we have time for one more question. And so I'm gonna try to make sure that all right. So the next question, the last question we have time for is as it relates to kind of positive self-talk. So it's my kind of instinctive feeling of excessive worry when it comes over me. Any tips for just kind of helping me as a parent, thinking about my child and safety for the family, how to kind of talk myself through or kind of work through that excessive worry?
Yeah, absolutely. I think speaking to yourself kindly and with compassion is sometimes something that as parents we overlook. We're so focused on everyone else that sometimes we forget to do that. And so it may seem sometimes even a little too much to take a couple of minutes, but taking a couple of minutes to write it down or do a voice note on your phone and then replay it. Does that sound very kind? Would I have said that to someone else? And then trying to take a moment to shift. I'm doing my best. I'm in the now doing what with the information that I have, the best that I can. If that's where you're at, that is a good place to be.
One more question. I know I said it was the last one, but one just came in, and one of our moms is asking, what is your favorite technique to kind of calm the body and calm the mind? What's your favorite?
That is a really good one. I have to say the most my favorite would be to go with the senses again, right? Taking a pause, 5 things you can see, 4 things you can hear. There's good if you Google the 5, 4, 3, 2, 1 grounding strategy. You'll have all the details, and I would encourage you to make note of that. It's really easy to do. People don't even need to know that you're taking a moment in your brain to kind of feel your surroundings and do that, but that's a personal favorite.
Excellent. So I'll repeat that for those who may be logging off soon, the 5, 4, 3, 2, 1 grounding strategy. I made a note for myself too as well.
Nice.
Dr. Gonzalez, thank you so much for taking the time to spend with us this afternoon and for sharing your expertise for our children and for ourselves. Thank you again and have a great afternoon. And I'm going to turn it back over to our co-chairs to close us out. Thank you, everyone.
Thank you, everyone.
Thank you, Michelle and Dr. Rodriguez. We have just a few reminders before we break. Be sure to check the conference app for updates, session descriptions, and the participant links for joining those sessions. We have a variety of breakout session options to choose from after the break. Some are live and some are pre-recorded. Details for which sessions are live are included in the session descriptions in the conference app. Live sessions will be recorded and made available for a limited time after the conference.
If you haven't yet checked out the Arthritis Foundation resources on the app, please do. There is a variant to access. Be sure to complete the JA Insights access link in the app. Don't forget to come back for the closing general session at 3 p.m. Eastern.
3:30 p.m.
Sorry, 3:30 p.m. Eastern.